60% of cancer patients experience severe distress. Experts call for urgent integration of psychosocial care on World Psycho-oncology Day 2025. Bengaluru, April 23, 2025. In a pivotal move to reshape cancer care in India, a high-level roundtable was held today to underscore the need for integrating psycho-oncology into mainstream cancer treatment. Organized to mark World Psycho-oncology Day 2025. The event, titled a Stakeholders Roundtable Deliberation on Integrating Psychosocial Care into Mainstream Cancer Management, was jointly hosted by Healthcare Global Enterprises Ltd (HCG) and the Centre of Psycho-oncology for Education and Research (COPA) with support from Global Healthcare Academy. The roundtable brought together prominent oncologists, psycho-oncologists, patient advocates, healthcare administrators and policymakers to highlight the emotional and psychological dimensions of cancer care. Hon'ble Shri Dinesh Gundu Rao, Minister of Health and Family Welfare, Government of Karnataka, graced the event as the chief guest. The objective of the roundtable was to recognize psychosocial care as an indispensable part of cancer management. Various international bodies and cancer care guidelines recognize emotional well-being as the sixth vital sign. The discussion underscored the need to integrate routine psychosocial assessments and dedicated professional psychological intervention into every stage of cancer treatment.
Better than me, or better than any cancer survivor, victor, or whoever you want to call it as. As soon as we hear cancer, even today, there is a lot of taboo in the society. So, if we have to segregate the whole process of cancer management, it can be done in 3 phases. Pre-phase, the diagnosis or planning for the treatment, and the actual treatment phase, and the post-treatment phase. And in all the 3 phases, psychosocial care plays a very crucial role. So, I would like to reflect on my own journey here. 5 years back, when I was diagnosed with palatal cancer, the whole identity was ripped apart. I was no more a person, turned into a patient. Every time, you're referred to as patient, that itself triggers a lot of emotional distress. And one more very important thing, which even today it gets that emotional, mixed emotions, is when I got the consciousness in ICU as soon as I woke up after my surgery. Lot of pain, lot of drain tube, swollen face, and oxygen mask everywhere. And the very first thing which came, no way of communication. So very first thing which came to my mind was, I just want to die. I don't want to live like this. This is not the life I signed for. And that's where, and luckily it was just a one-time thought, because as I had access to excellent medical care, and along with that beautiful family support, and also the professional guidance, where series of counseling sessions were planned and other supportive therapies were also part of it. But how?
But I think this could have happened without my presence also, I feel. Because I think it's a very technical subject, and it is a subject I think which of course, I think is an evolving subject, and we all know that people who suffer from cancer, the problems that they go through, and definitely these kind of support system with the patient and the patient's family get will be of great value. There's no doubt about it. And why I said my presence was not that much required is, as a government, for us to make any policy as such on this is not, immediately feasible for us to say that we will create posts, or we will create some sort of advisory, those kind of things. But of course, the cancer itself is a specialized subject, and which comes under medical education department. I am the health minister, where I cover more of the primary health and preventive care, preventive medicine, and basic health care, and all the super specialties like cancer and neurology and cardiology. All that is covered by the medical education, and Dr. Naveen was here rightfully, and I think his views almost represent the government's views, because he sees people on a daily basis. So as a need, there's a need, there's no doubt about it, because support is needed. Just like what everyone said, it helps in doctor-patient communication, it helps in families to cope with it, it helps the patient to understand and to manage to cope with it. So there's no, I think, real argument for it not to be used. I think it's a great value add to the whole process of treatment, and medicine is becoming more and more, when we discuss about treatment and procedures and well-being and health, everything is becoming more and more holistic. I think the thinking is to be how we can be more holistic, and it's not just diagnosing and giving the right treatment, but how do we approach it in a holistic manner so that the patient also survives and will have a good long-term, happy life that he can lead. So when you talk about a holistic approach, this becomes part of it, and to be able to be counseled and to be able to handle the not just the physical well-being but also the mental and the emotional well-being. I think the emotional well-being becomes very important. And so I've seen, because even my own family, my father also had AML and he passed away due to cancer. My father's sister also passed away due to cancer, and my father's mother also passed away due to cancer. So I've seen cancer at a very at a very close range. And when my father passed away, he was 56 years old. I was about 23 years old. So at that time we really don't know too many things, and it's always like we just have to go by what the doctor says. If the doctor is communicative, fine. And in those days I think they were less communicative. Now people are getting more and more aware. So I think for it to become more widely accepted, I think the fact that you're doing this kind of conference enhances awareness of people, the need for these kind of things in private institutions and in government institutions, and we start working towards how we can co-opt this system into our existing system, how we can add this on to probably not just cancer, but I think any debilitating disease needs emotional and psychological support. Whether it is there's so many diseases which are like terminal illnesses, or people who have got less chances of survival, all those things. So this is not, I think, psycho-oncology is a specialized field, because oncology is so specialized. So it needs someone who's an expert. But at the same time, I think we can't now go on creating. I think it's people should not feel offended, but for every specialized field, we can't have a specialized counselor. I think every hospital first, if they can provide a general counselor, a general psychologist for all these kind of patients, so that whether it is an oncological treatment or whether for a neurological treatment, whether you've got some other fatal disease, for all these kind of patients, if there is a psychiatric and clinical psychologist and that kind of a support provided by hospitals, I think it will have a great impact, and that should become part of any treatment that is provided by hospitals. And so when I looked at the opinion of all the doctors, nobody was saying that this is not needed. The only thing, how we can bring it in to our system, how we can make it affordable, how we can bear the cost. Ultimately, everything is a cost, and finally the cost is borne by the patient. Nobody else is going to bear the cost. Either the hospital management will bear the cost, or any service provider will bear the cost. The patient has to bear. So how do we, and so whether it is how do we bring it in, and whether we can make it optional, or the availability of the resource. So there's so many factors. So I would request Dr. Brinda also, whether anything that from the government she expects us to do. Definitely we will try and incorporate those things. We can look at those things, what we can do, any specific suggestions if are given by you or by anybody over here. We will definitely have got an open mind, and like our policy which you mentioned about the right to end life and for palliative care. I think we took a very historic decision on that, where now today in Karnataka you are legally allowed to have a medical directive that if this thing happens to me, this is the way I want to be treated. And suppose someone is fatally ill, there is a procedure now to where legally doctors or the family can take a decision to end the person's life. So these are things that we did after a lot of consultation with a lot of people, and with some people who came forward saying that this needs to be done. And similarly, on this, anything that you want us to do, our government priorities are many, and our focus is always on how we can, we have got so much of load as it is, and so much of work, that we need to do to ensure that our people get, people are more healthy. So the pressure is always on the immediate. So these things, I think with support of private organizations, NGOs, think tanks, definitely we can work with them. And like how Dr. Vishal is here, we worked on the tobacco eradication program, how we made the laws more stricter, and we took some decisions which ultimately has benefited society. So like that, we are willing to play a role, but I think your organization and your efforts, I think I want to appreciate that. You take a lot of interest, and it's not easy to bring all these people together, and you've done that. So hopefully, this will lead to better outcomes in the future. So thank you for also making me a part of this. Thank you.